Good afternoon, this is Dr. Do again. This video is quarantine special edition video number 36. Today I'm going to talk about the cellular, the hypersensitivity and the immunity. I talked the immunity before, just touch very superficial on the hypersensitivity. This video I'll just spend a little more time expanded and with explanation of the immunity, cellular immunity and humoral immunity. As I talked before, the antibody is involved in humoral immunity, the IgA, IgE, IgG, IgM, etc., etc. In this hypersensitivity, the major antibody involved is IgE. I think I mentioned it, but I'm going to explain it later on. And also the cellular immunity, which mediated the type 4 hypersensitivity. Any emergencies, yes, anaphylaxis, like acute allergic reaction, you know it, like bee or penicillin or any hives make you feel difficult breathing. In addition to the skin rashes, you feel difficult breathing, or you feel not comfortable, or dizziness, which means hypotension. So these are the emergency. For those you have the pen, the epinephrine with you for those known allergies to either bee stings or the peanuts. So this is the emergency situation. For other type of hypersensitivity, I'm going to break down. There are four types of the hypersensitivity. The type 1 is the emergency situation, either caused by penicillin, for example, the bee stings or peanuts or the hives. So these are all belong to the could be very serious, because these kind of hypersensitivity, IgE involved in the master cells release a huge amount of the blood vessel dilators. In addition, cause the rash, could dilate the blood vessel, lower the blood pressure, cause hypotension, also can cause the swelling of the respiratory tract, so that will be impaired respiratory function. So that's the emergency situation. So this is the, can you manage at home? Let's see, probably no. I still say no, unless your doctor already cleared up. You do not have serious type 1, or you have the contact dermatitis, which belongs to type 4, you can manage at home, prescribe medication or over-the-counter anti-itch medication. I'm going to explain in details. Okay, so that's the emergency, and also the home management. Basically, you have to clear up by your physician, regardless of what type. If not going to emergency, you have to see your physician. Okay, so there are 4 types of hypersensitivity. Like type 1, I already said, is antibody IgE mediated hypersensitivity. Anaphylaxis, IgE bind to the receptors on the master cells, like I said, release huge amount of histamine and other blood vessel dilators, cause hypotension, edema, and swelling of the tissue is very dangerous and life-threatening. And there are type 2 and type 3 hypersensitivity. For example, the hemolysis, which is the type 2 hypersensitivity, is caused the red blood cells break down because of the mismatch of the antigen antibody. The blood type mismatch causes this kind of hemolysis. And type 3 hypersensitivity usually refers to a group of autoimmune disease. Actually, not quite. It's an antigen antibody combined deposit on the membranous structure. For example, there's nephrotic disease, nephrotic syndrome. One of those kind of nephrotic disease is caused by this type 3 hypersensitivity. The antigen antibody with the help of complement and bind together and deposit on the membranous structure, cause the whole body, the lung or the kidney, lost the function. If it occurs in the lung, so then the oxygen exchange will be impaired. If it occurs in the kidney, then filter membrane will be damaged, losing protein. So this is the type 1, 2, 3, the mechanism. And type 4 is and those type 1, 2, 3 is kind of fast to happen. It's not called delayed because it's humoral antibody mediated. For the type 4, it's cellular mediated. Like I will explain this. Their cellular immunity mainly refers to the T cells and the lymphocyte of T cells. There are 4 types of T cells: helper cells, cytotoxic cells, memory cells, surveillance cells, etc., etc. So this T cells has the special antibody. So T cell bind to the antibody and cause the slowly release reaction, the localized blood vessel damage and the rash. Example for this is contact dermatitis, or the TB test. Actually, the mechanism of the TB test, if you remember, if you have done this, you went to the physician office, you had the travel history, or you had contact, or you immigrated from the United States from other country, the intradermal injection of this small amount of the BBG, which is a protein extracted from the TB bacteria, and causes this delayed hypersensitivity. 2 days later, you went back to check whether you had it or you do not have it. So this is the type 4 hypersensitivity. Like the contact dermatitis, you can manage easily. Just do not contact the nickels or whatever caused like the IV or any causative agent. Just avoid those contact causative agent, or use some antihistamine creams. But if it does not go away, you need to see your physician. I'm not saying that you cannot manage at home, but it's good to clear up, to make sure it is not anything else, to diagnose as contact dermatitis. Then you can manage your prescription medication, and by seeing manage means avoid prevention. Actually, avoid contact those causative either nickels or the poison IV or whatever cause the local reaction. So this is the hypersensitivity with the superficial, very touch the surface of explanation, the hypersensitivity. The message is for the type 1 hypersensitivity. You already know it, probably, and the season is coming here. A lot of allergies, the hives and the bee stings start to fly around. So I just thought it's a good time to throw this video here. It's very superficial again, touch some fundamental basis for the hypersensitivity anaphylaxis reaction. So the worst scenario is go to the emergency. Otherwise, the anaphylactic shock is could be very dangerous, life-threatening because of hypotension. So that is for this video. Very short, very brief. And I just remind you, I'm sure if you had allergy, you already know it. Just the season is here, so I just thought to remind you, just make sure, avoid the causative agent, causal factors. So, so that is for today. I thank you for watching. I will see you next time.